Good morning, one and all. Today we are going to see about newborn assessment. So, healthy newborn defined as any child born at term, that means 38 to 42 weeks, and cries immediately, establishes rhythmic respiration and average birth weight, and easily adapt with the extra environment and no gross congenital anomalies. This is the normal healthy newborn. You have to assess the newborn whether the newborn is normal or any abnormal conditions. Newborn, there's a two age, that means gestational age and the embryonic age. Gestational age is calculated from 0 days to 1 week and 6 days old. That means 1 to 14 days from last menstruation. And embryonic age is 2 to 1 weeks old. So difference between gestational age and the embryonic age is 2 weeks. That means if gestational age is 8 weeks, embryonic age is 6 weeks. The purpose of newborn assessment is identify the sick newborn and review any problem with the newborn, or review the weight and head circumference of measurements, and check the newborn past urine and meconium, and identify any neonatal problems, diagnose any congenital malformations. And general guidelines for newborn assessment, it should be done as soon as possible after the birth, and the newborn should be stabilized before starting detailed assessment, and the examination can be conducted without awakening of the baby, although he will need to expose to intervals from the complete and accurate examination. Nurse's hand must be washed thoroughly and dried before starting the assessment. The newborn should be protected from harmful process like chilling and nosocomial infections. The examination should be done systematically. A head-to-toe systems approach to be followed for complete examination, and the examination may be carried out with the baby in a warmed crib on examinations. And there is a three neonatal examinations. The first examination should be conducted 1 hour within 1 hour labor room, or within 2 hours of birth, or within 24 hours. A second examination so before discharge from the hospitals. Third examination after 6 to 8 weeks of neonatal life. And articles required for neonatal examination, and TP, temperature pulse respiration tray, and another tray, assessment tray containing hand washing articles and apron, stethoscope for auscultation, inch tape for the measuring the head circumference, chest, and a torch for visualize the eye and other areas, and bowel and cotton wipers, and weighing machine for assess the weight, Macintosh, kidney tray, and paper pick. So basis, there are four bases of newborn assessment. So initial assessment by using Apgar scoring system, and the transitional assessment during the period of reactivity, and assessment of gestational age, and systematic physical examination and behavioral assessment. So first basis assessing the Apgar scoring system. So it is found by the Virginia Apgar. So it means name itself told it as A for activity, P for pulse, and G for grimace, and appearance, A for appearance, and R for respiration. So total possible score is 10. If 0 to 3 score severely, the newborn is severely depressed. If score is 4 to 6, moderately depressed, or 7 to 10, and excellent condition is a normal newborn. A transitional assessment, there is a two periods. So the first period of reactivity, 6 to 8 hours after birth. During the first 30 minutes, the newborn is very alert and cries vigorously, and physiological respiratory rate is more, and bowel sounds are active, mucus secretions are increased, and temperature may be decreased slightly. And second period of reactivity assessment begin when the newborn awake from the deep sleep. It lasts for about 2 to 5 hours. Newborn is alert and responsive. Heart and respiratory rate are increased. Gastric and respiratory secretions are increased, and passage of meconium commonly occurs. So, following this stage is a period of stabilization of physiological system and a changing pattern of sleep and activity. And assessment of gestational age, then means AGA. SGA means small for gestational age. That is in a growth chart. There is a between the 19th to 10th, below the 10th percentile. And so this is a, growth chart. If the growth is in between the 19th to 10th percentile, it is appropriate for gestational age. If below the 10th percentile and small for gestational age and above the 90th percentile, considered as large for gestational age. So another one assessment is term. The full term 37 to 42 weeks, pre-term before 37 weeks, post-term after 42 weeks. So this is the difference between the preterm and post-term baby. This is assessment of gestational age by characters, skin, if Lengo highly present, oily and shiny, it is a preterm, less shiny and pink and turquoise is a term. Hair, a black coat is term, if it is fine or very fine is preterm and transitional. Breast nodule and nipple formation, breast tissue more than 10 mm and nipple raised is term PV, breast tissue less than 5 mm, no nipple preterm, if it between 5 to 10 mm or nipple percent are not raised is transitional, and ear cartilage that is pinna soft and no recoil, and if transitional some cartilage and some recoil, firm cartilage and recoil is term BB. And genitalia male testis not descend because the testis is descend after 28 weeks. If preterm baby, uh, if preterm baby less than 28 weeks, there is no testis in the scrotum. The testis in the inguinal, and testis at the scrotum is a term baby. And genitalia female, predominant labia minora and transitional sum, and labia majora completely cover minora is a term baby. The neurological assessment by four areas: muscle tone, joint mobility, and automatic reflex, and fundus examination. So, muscle tone, we are assessing the posture or attitude, or passive tone and active tone. There is a by popliteal angle and a scarp sign and arm recoils. So, this is the popliteal angle assessment. There is a flex the lower leg on thigh and then flex the thigh on abdomen. While holding the knee with the thumb and the index finger, extend the lower leg with the index finger of other hand, measure the degree of angle behind the knee. Scarf sign. Baby in supine and support the head in middle line with one hand and use another hand to pull the infant's arm across the shoulder so that the infant hand touches the shoulder. Determine the location of the elbow to midline. So this is the interpretation. So age 0 to 3 months, popliteal angle 8 degree to 100 degree, elbows does not cross the midline. If 4 to 6 months, 90 to 120, elbow crosses the midline, and 7 to 9 months, 9 months, elbow 110 to 160, and elbow goes beyond axillary line. Joint mobility. You are assessing the joint mobility. Uh, Joint mobility is less in preterm baby. A term baby has more flexible and relaxed joints. A degree of flexion at angle and wrist is limited. There is a test is called a square window. So this is the square window test. Apply a gentle pressure with index finger on tarsum of hand and without rotating the infant wrist. So measure the angle between the base of thumb and forearm. So before 28 weeks, that means preterm, wrist cannot flex to more than 90 degree. Assessment of gestational age by automatic reflexes like Moro reflex, pupillary response to light, and blink response to glabellar tap, and grasp response are assessed to detect the specific age of gestational maturity based on the appearance of these reflexes. Fundus examination for disappearance of anterior vascular capsule of the lens is done to assess the gestational age. Anterior capsule is completely vascularized in infant less than 28 weeks. So vessels are almost atrophied at 34 weeks of gestational age.